Optimal Bio podcast. At Optimal Bio, we don't just balance your hormones, we balance your whole body. Our conversations range from nutrition to medicine with an emphasis on wellness tips to support your health journey. If you like what you hear, find us on the web at optimalbio.com and follow the podcast so you don't miss an episode.
Welcome, everybody, to another edition of Optimal Bio, a podcast about health, wellness, and overall business. Today, we thought we'd do a deeper dive on BHRT pellets and how they're manufactured and who manufacture them. And today we have a special guest, Shaun Riney, CEO of Qualgen. Shaun, welcome.
Hey, thanks, Jim. It's great to be here. I'm glad you guys invited me to come talk.
No, it's a pleasure, and thank you for providing some time for us today. If you wouldn't mind just kind of giving us a little bit about your background and an intro to the audience.
Yeah, so I am a Oklahoma native, just right off the bat, and I've got two boys that are they're good boys. We'll put it that way. They're like any other children, but they're great. And I've been in business since the day I got out of college as an entrepreneur, which is a little rare. I worked in the banking system for a little bit and had a manufacturing company I owned, and I helped grow that up to sell it. And then I was in the financial area doing web and internet billing, banking, and bill pay stuff for about 12 years. And then I grew that business up enough that somebody wanted to buy it and sold it. And then I got out of that business and got into this area of healthcare by working with different doctors that were in the hospitals area wanting to get out and do other more specific things on their own, and ran into HRT with a bunch of doctors, and they had a glorious idea for me to make pellets, which was kind of crazy because I'm a web guy. But next thing you know, took about 2 or 3 years. We were working on all that, and the next thing we know, we're in the 503B space, making testosterone and estradiol pellets for bio-identical hormone therapy.
That's a pretty great story. And let's go back, though. Let's go back to your childhood. And I, like you, I've started and owned my own company and sold it. And was there a moment in time, when you're 12, 13 years old that, you're doing yard work for a neighbor or you're shoveling snow, maybe not in Oklahoma, but you're doing stuff and you realize, hey, man, I really want to be an entrepreneur someday? I mean, can you kind of walk us back through your childhood a little bit?
Well, yeah, I remember I grew up in the 70s, so I thought I was going to be Burt Reynolds and drive a Trans Am across the U.S. and chase girls. And that was a favorite movie of mine. Only some people know what that is. And as crazy as it is, he was
Smokey and the Bandit, right?
Crazy it is, he was my hero at the time, And no, for some reason, my mom, I think, literally by subliminally dropping into my head, I needed to be an attorney, I think. And somehow I wound up with that in college, and then I ended up in law school for a little bit, only to have about a D average on a well level in there. And I knew that was not for me. And I liked business, and I had started the company I first sold and is the manufacturing thing. And I knew right there, I love to build stuff. That's what I like the most. I like to build things, and I love to watch the face of employees or other people that get excited and they enjoy what they're doing. And that's the most joy to me, is watching other people have success within my success. That's awesome. That's what I like the most.
So where'd you go to college?
I went to college at the University of Oklahoma here at Boomer Sooner. And then I also went to Oklahoma City University.
Okay. And then why did you start the manufacturing business up when you were still in school?
I started that a little bit. Like I said, I was trying to go to law school. I was doing way too much. I was doing about 4 things at once. And I even had, by the way, that law school degree had a weird deal. I'm a true believer in Christ, and I'm a mega follower, and he's my everything. And I'll tell you, I've been since college. And so I wanted to get a master's in divinity as well with my law degree, which was like insanity. And so no wonder I had a D in law, right? And so I kind of stuck to it for a while, and I dropped out of that because I decided, I'm not going to be a pastor, and that is a tough life. And I figured out that wasn't for me either. Although I love the history of Christianity and everything goes along with it, it's just one of my favorite subjects, and it's fun to study and be with friends around that like to study that too. But I went back to building stuff, so that's kind of how that went.
So as a believer as well, we tend to, hopefully a lot of us, pray and contemplate and think about what God is telling us. And when it sounds to me like you're like to have a lot of things on your plate at all times. And, as you're going through contemplating divinity school and what have you, was there something that happened in your life, or was it just something that, came in your head that made that decision for you not to do that at this point?
I'll tell you, I was working within the Presbyterian church at that time, and I was on the side working with a youth group. And I remember my mind goes back. Now, I'm pretty old now, Jim, so I was very young back then, so we had to go back. And my mind goes back. I do remember this pretty vividly. After about 2 or 3 weekends of you go through a baptism, to a high school graduation, to a birthday party, to a 4-year-old death, or a high school kid that got killed in a car wreck. And my emotions were all over the planet. And there was even worse things involved with that with some of the children. And I realized then that I would be a much better person outside than inside trying to help. And I just was not made up to do that. That's a tough job. And I have so much respect for the people that do that, because day in and day out, the things they know and go through are extremely difficult.
Yeah, I've heard from other pastors too, and it is difficult, and you got to be a special person to be able to do it. So you get this manufacturing business, and I'm assuming that you just had on-the-job training in terms of being a leader and managing and buying raw materials and getting a product out the door and everything else. So kind of walk us through how you learned on the job and some of your speed bumps that you hit that you had to overcome.
So within Qualgen, a little bit of natural to me, because in the manufacturing I did, I actually made engines for Ford and other OEMs back then, original equipment manufacturers. And so the ISO standards were high already, much like GMP within the 503B ranks that we have to follow for FDA, which is a standard. Very used to that, very high standards for that, because Ford and the other manufacturers wouldn't pass your stuff if you didn't have all the ISO standards in place and documented. And then, of course, in the banking business, extremely regulated, as we very well know. I'm in fact in Oklahoma, where the deregulation started, right here with Penn Square Bank back in the early 80s. So I knew all about that, had to deal with a lot of the bank regulations and those types of things. And of course, you get into the drug world, it's probably as much, if not more. It's a different regulation. The banks and all tend to be more, they work with you, and it's more of a different relationship than in the drug world. It seems to be more punitive, and it's a little tougher. It's a lot more difficult relationship. So I've had the regulation of that's been pretty good. And so understanding processes and all that really helped. I also, when I was in college, I got lucky. I got to work on a Fulbright scholarship with a guy by the name of Dr. Robert Ham. And I worked on a deal with a company in Arkansas called Baldor Corporation, make electric motors. It took me about 2 years of research. We were trying to help them do the analysis to put a plant in Czechoslovakia when the Berlin Wall fell down in 91 and all that, and the East countries all open everything. And hey, we're going to make a lot of money. And so I had to do a lot of Deming, Edward Deming research. I don't know if you ever heard of him. Yeah. So, and of course, the United States put him in China because they thought he was or in Japan right after the war, and because they all thought he was a quack. And he ends up not being a quack, and his mathematical statistical process controls end up being a big deal, of course. And then we all know what Toyota and those guys did after the years with that. So I studied him because Dr. Ham thought it was important to understand a lot of the statistical process controls for what we were going to be doing in Czechoslovakia. And so I actually ended up doing enough on that. We created a manual. I'll never forget. We ended up doing seminars on it. And Dr. Ham would talk to it. We did such a good job. And he ended up making money on that, which was great. And we traveled around doing that. But And by the way, the plant never got built in Czechoslovakia because in the final meetings, we decided, and it was another group that was doing an analysis outside of us that was actually out of Chicago, decided that the socialism there in the country, the worker did not understand the true nature of quality. And they're like, and to us in the United States, you shake your head, you don't understand that. But, they got a paycheck, whether it was a good piece of product or bad, it didn't matter. And of course, the guy's name was Dr. Qual, who was in charge of this at Baldor at the time. He said, look, quality is everything, especially for our engines, what we're going to be building. And if we're not going to be able to reassure that 100% and all the workers are going to have this type of mindset, there's no reason to work on it. So they pulled out, which is an interesting story, just, to think about what's going on in today's world. If you think about that, those types of thinking have lots of ramifications. The circle comes full round. So quality is a huge deal to me. I understand that from a high level, and everything we've always done, we tend to take the higher road. It is always more expensive, and that's why our products are not the least expensive. They're more money, and the reason is because of the quality that's in them. We don't do anything that is cheap or any shortcuts. It just doesn't exist.
Yeah, I had spent 25 years in the clinical trial business. They call my company a CRO, and we work with small and mid-size biotech and pharmaceutical, mostly doing oncology trials in phase 1 and phase 2. So, we understand the regulation like you do, and obviously we always have to be prepared for an audit and what have you. At the time, though, we had also opened up a location in India, to be able to outsource some of our work to, and we thought it'd be pretty easy just because it's lower labor. They're very educated over there, and we thought we could just set up a shop and not have to really worry about managing it. We could just send work over and it would come back in perfect order. And we found out in a very short time that we actually had to provide more management oversight just simply because of the culture there in terms of delivering work was different than the U.S. And did you also find that same problem when you were trying to do something in Czechoslovakia as well?
Absolutely. I'll tell you a story more close to home. I own another company called Renewal Pharma that we have facilities in other countries, one in Brazil particularly. And the culture, is that a little bit what you're talking about, and is how people think and what they do is totally different, and how you do business. And in fact, not only that, how you do business, but how you conduct business and how they do processes. We went down there and we had all kinds of trouble right off the bat because they thought we were crazy on how we were doing things here. And, you're looking at, no, you're crazy, type thing. But, it's not that at all. It's just a difference of thinking and how they're raised and what they go through. I think that's my answer. And I'd never encountered that at that level. So like what you're talking about, and you don't have that in your business plan, oh yeah, cultural differences, what is that? That wasn't in the forecast. Right.
I traveled over there and we took the whole team out to dinner one night, and one of the people I was with, he was a U.S. citizen, but he had been raised in India. He'd come over here to go to school, and he stayed and to work and what have you. And he goes, "Here's the biggest difference." He goes, "In the U.S., if somebody says yes to you, then you trust that they're going to actually get the job done. Whereas in India, at this point in time, if it's an open-ended question and the answer is yes, it means that yes, I acknowledge what you're saying, but there's no confirmation that they can actually get the job done." And that's not a criticism on India. It's more of a criticism on, I think, me and my company at that point in time, in reference to being able to communicate, the right way to make sure that everybody understood what needed to be done.
Yes, I think the foreign countries help us. I agree with that 100%. It changed how you look at communication. It really does. And that's a big factor, of course. I agree, 100%.
So with your operation in Oklahoma, are you 100% U.S. based?
Yes, everything here is U.S. based. We operate 2 facilities here, getting ready to be 3, and they're all within about, I wish they were all right next to each other, but we're spread out over about a mile and a half of 3 different buildings. We have a current facility we operate in Edmond, Oklahoma, that is our main operation facility. We founded that in 2015, I'm going to say. And we bought a new building, brand new, about 2 years ago, and have been working on opening that facility. And we are like 60 days away, basically, from finishing that facility. And it's one of those deals. You build your first one and you learn. And this next one is 10 times better and more. And of course, it's newer, and it's 10 years newer with 10-year better technology and all that kind of stuff. So I'm real excited about it. And it also gives us more expansion, as well as we've now expanded into, we do our own labs. We have our own full up R&D testing, as well as laboratory testing for release items. We have tons of equipment we never even thought we would be doing when we started this. So we're big in the R&D world now, which, in the compounding world with pharmacists in the past, I've worked with some old school pharmacists, and they're just kind of funny guys because they'll just kind of go in the back with a couple things and put them on a mortar pestle and kind of grind around for a minute and go, that looks good. Next thing you know, they got a drug. And it's true, because that's how compounding was from the 1930s up. That's the way it was. And of course, in today's day and age, then this NECC thing that happened a while back, it's all changed, and especially on sterile drugs, and it's understood, because it's a dangerment to society, and there's got to be the right amount of rules in place, regulations to make sure that the products are safe, which is the number one thing. And then, of course, the next thing is that the drugs actually do what you're professing that you're going to do, and they're what they are. And so with that comes, tons of more, not only processes, but technology and people and knowledge and that kind of thing, which, in the old pharmacy compounder in 1955, that was not on the laundry list. They were more upset when the soda fountain broke, and, everybody was upset about that.
Right.
I'm not trying to belittle it. I'm just saying it's just totally different today. And any pharmacist today that can tell you that, what it was back then today is not anywhere near it. And then we're really a 503B, which is really much closer to, even though we do compounds, we're more like a manufacturer, because what we put together is the same code that a manufacturer uses. We're no different than what Pfizer or somebody else has to do for the most part. So we're doing compounds, but they're the integrity, I guess, with the word of the product is off the chart. And then all the 503Bs in the United States run that same gun. It's very difficult because it's very expensive, as you might imagine.
Sure. So let's educate our audience a little bit. From a very simple explanation, what is the difference between a pharmaceutical and a compound?
Well, one is, when you think of drugs, I think most people out there think of, Pfizer. Here we are in the vaccine age, right?
Right.
Those are drugs that have been made by big pharma, as they call them in this world, that are been through clinical trial, and that's how they make sure they're safe for their efficacy of them. And by the way, this is all a major argument right now, so I'm going to get in a real touchy space here with different people. But I'm going to go for it, okay? I'm going to be as polite as I can. But those drugs are what they are. And we all watch the commercials at the end of the drug, and they'll end up telling you that, it could create anything from diarrhea, nausea, or death. And you're like, wow, I don't want to take that drug. But that's because it came out of the clinical trials, and they have to, the Transparency Act and all the things that have gone on, they have to disclose that to you that, some people have died taking this medicine, which this is all in our litigious state that we're in, to make sure that, somebody told you that that's possible in case it happens. They don't want the liability. Mm-hmm. In the compounding world, so that's the big thing right there, big change, big difference. In the compounding world, we don't go through clinical trials like that can take 3 to 7 years or whatever, if you will, whereas you would on a drug like that. And the safety then comes down to what I was talking about with what we work with called GMPs, good manufacturing practices, that we do tons of testing, basically, to verify and ensure that the drug has been tested for safety and what the drug is, so that, we don't release anything that's bad. And that's, it's pretty big. Whereas in the old compounding world, they didn't do that. And in our world, we do. So we basically test for everything that big pharma guy is going to test for. but we don't have the clinical trial. But like in the pellet world, they've been around for, good grief, really hundreds of years, since the 30s. The number one thing you guys have been been around since then. And the safety and efficacy of that product is sound. It's been around a long time. Real simple. We live in a capitalist world. If it didn't work, nobody would do it. They would have given up on it a long time ago. And the safety of it at this point, we used to autoclave pellets back in the compounding days. I remember that. And everybody thought that was a way to sterilize, and it's not a method. It doesn't really work. And so we found out we irradiate everything now. It's not gamma, it's E-beam irradiation. So it's not what you would think a nuclear type of situation. It's done with electrical beams. And that's what kills all the nasties that would hurt you or such. And we did almost 4 years of studies on that, just in case you want to know how long that took. And the reports themselves are thousands of pages to show the sterility assurance of that product so that it's safe. And that's FDA reviewed and regulated and all that too. So that's it's still very safe, but not the same as that clinical trial. The clinical trial is going to tell you more about, to me, of what it's going to do per patient, or what they would think it would do in a patient population. And to me, in the pellet world, that data has been recognized over hundreds of years of doctors been doing this for a long time. And then like at Optimal Bio, your people there, have been doing this a long time. They can pretty much tell you after years of doing it, a lot of results of what they're going to get because they've got the experience. So there's the differences, I would think.
And as a compounder, are you using approved ingredients by the FDA, whereas the pharmaceutical, it's a molecule, it's something new, and it's never been in market before? Is there a difference there too, or is that not the case?
Well, now as a compounder, I'm using a drug that has already been approved somewhere down the line. Whereas Big Pharma, like you said, they're creating a whole new molecule. It's something you've never seen before. It's a new drug, that kind of thing. Just like we'll pick on Viagra for a minute. It was a big deal when it first came out and what all it would do, and nothing like it. There was nothing in the market for it. And then all of a sudden, like today, you can compound with it. Sildenafil is now come off list, as they say, and is now a compoundable product. And so we can buy that product now in bulk, as they would call it in our world, 503B, and we can compound with it. Whereas like Pfizer, who made that drug way back in the day, trying to just pick on the American companies here, Jim. When they made that back in the day, that was a brand new thing. It was a big thing, and a new molecule, like you said, and a new drug. So we can only compound with drugs that have already been made, or with products like testosterone that has already been made and agreed with the FDA. We can't make anything anew, so to speak. We're not allowed to do that.
Right. Yeah, so you're not in the novel therapeutics. No. So you talked before about 503B2. That's obviously a different segment within the FDA where you can do just a simple safety trial compared to a full-blown safety and efficacy trial in the pharmaceutical time?
505B2, yes.
505B2, sorry.
Yeah, that's an interesting topic. So that comes out of 1984, somebody in Waxman Act that was made. And they did that because if I go back to my history, remember I'm a history guy, so I like to know these types of things, like why did they do this? The clinical trials, of course, take a long time. And that's been part of the problem with the FDA. I think we all know that today, that the number one thing was, Moderna and these guys had these vaccines out there and they hadn't been approved yet. And President Trump said, no, we're going to do this fast track thing. I think that's what they called that. And we're going to get these out
Warp
in the market.
Speed.
What's that?
Warp speed.
Warp speed. That's it. And we're going to get these out in the market and get people saved, which was smart. And because I think that the bureaucracy within the FDA, you have to remember back in the 60s, 70s, had 500 people or whatever, 1,000. There's now over 17,000 people in that organization. It's crazy.
It's crazy.
So, when you get any organization that big, you're going to get lack of communication. You're going to have communication breakdowns. It's going to get difficult, and that's understood. But it's too bad is what it is. So what happened there is, I think in 1984, it's kind of funny the date of that, right? Because then you have the book 1984. So you go to in 1984 when the Waxman Act, I call it that because I know it's one of the guys who was in it, did this, was to provide some drugs that you could get them to the market quicker. And it's kind of like an abbreviated NDA, so to speak. That's not totally the case, but you could do that with certain drugs so that it wouldn't take, 3 to 7 years to see a new drug get on the shelf. And to me, the advancement with technology is killing this too, because, wow, you and I are young enough men that, we've seen a guy go to the moon and all that, and some kids don't really understand what that means. But before that guy landed on the moon, if you would have told us that, we would have went, yeah, right, sure, whatever. And in this day and age, they're flying up space and back. And anyway, technology just keeps going at this speed that's insane. I think Trump said at warp speed. He's right about that. And so drugs and technology, drugs are a form of technology, and they're moving at that same pace. So if you've got to wait on something that started to be R&D today and 7 years from now, it's archaic 7 years from now because there's something else. So we've got to have a better process to make drugs better and faster. And that's a problem, and it's going to be a problem until Congress and some other people decide to make some changes there. There's no doubt about it. And the 505B2 is a way to do that. That is a possible. There's things there, and it gets you got to know all the rules, so to speak. It's complicated, to say it that way.
So how do you feel about the following? There's a theory out there because of the change in the FDA over years. To your point, when we were both younger, and especially in my early days within my company, it took a long time for a drug to get approved. And I remember, trying to figure out ways where through compassionate studies, you can get people on the drug, that were, let's say, stage 4 with certain cancers. And the FDA at times would refuse, to allow these people on. And it seems like today the argument is because it's gotten so big and it's been infiltrated mostly by the pharmaceutical firms, that we're now approving things that we almost too fast. We're not really looking at the data. And since you're in the mix, so to speak, is that a myth or is that true?
Wow, that's an interesting question. Well, I know in my world, what we do, it's all about the science. And you hear this, follow the science, and they're not doing it a lot of times, kind of like what you're saying. And I think it just goes in and out, Jim. I think it depends on the topic and the product and the space that you're in. And then, of course, I hate to say it, but I think we're all adults here and know that politics do exist, whether you like it or not. It's a reality of life, and it's not going away. And so you have to learn how to manage those things together and communicate. And that seems to be the big trouble. It's like the 4 kids on the playground in 6th grade that not one of them want to agree which was the prettiest girl, so they get in a fight about it. It's dumb, but it's junior high.
Right.
But that's kind of what goes on. And I just sit back in my own seat and just kind of, you're just like, wow, this could be a lot better than it is. It's just a matter of communicating and working together better, as opposed to somebody trying to tell you what's better or what's not better because it's their opinion. And so, like what you said, you go back to the science. Science is science. Science doesn't lie. It can't. And it just is what it is. And so what you get a lot of this is some people have a theory of there needs to be more testing or more trials or more this or more that. I don't know. Here, the bad news is I'm not a doctor or a pharmacist or any kind of a medical person. I'm a business guy that just uses common logic is about all I've got. And the good news is I have a high advantage because I'm from Oklahoma, of course. So, the IQ is higher than some. And,
of course.
And right, of course. And our farm logic that we use down here in this part of the world is pretty simple. We don't try to get it too complicated for a lot of reasons. And I'm not making fun of that. I am a little bit, but from a standpoint, I think some people do get this so complicated that you can't get anywhere. And that becomes a problem. We get so infested with we got to have all these things in this data. And the reality is, no, you really don't, in some instances. And so I think it gets out of hand. I guess that's it's a very political, good answer, Jim. I went roundabout on your question and I'll be around it to give you my belief in that.
Good news is you answered it. The bad news is we're not sure exactly how you answered it. But so I will say this. So talk to me a little bit about the explosion of compounding. Again, 20, 25 years ago, you very rarely heard about it. And it seems like today it's, especially on the storefront, it's taken off. And obviously from a manufacturing standpoint, I'll let you speak to that. But it seems like there's more manufacturers doing it now as well. So how did that happen? Was it all back again to 1984 and the act that was passed, or is it something else that happened?
I think, there's a little bit here. Number one, the creation of the 503Bs in 2015, that added to that because it didn't exist before then. You just had your good old pharmacy guys making compounds. They've been doing it forever. And by the way, those guys did a great job. I mean, hats off and applauding them. There's nothing wrong with what they've ever done and still doing. And I think that's an art form a little bit, as well as what it is as far as science. And man, if we ever stick a fork in that, shame on us, because that's one of the pillars of medicine, in my opinion. And I think it's become more light because if you think about it, let's go back to 1955. You didn't have a lot of on-the-shelf brand drugs. Everything was compounded. Mm-hmm. Everything. So it kind of went away there with law and all these guys creating all these big pharma companies create all these drugs and patents and such. And now we have, I don't know how many drugs are now. I mean, there's a lot. There's a bunch. And the purple list, orange list, they call them, of list of drugs that are out there that are branded and in the system. And so you come back to the compounders, and that's the drugs they use to compound, because they take those off the shelf and mix up whatever. And I go back to, I always pick on one that I had as a kid that I'd always get sick, and you'd go in and the first thing they'd give me was a compound of cough syrup with codeine, to help your throat. I mean, you know right. What I'm saying? And stuff was nasty, but it worked. I mean, it worked. It did the job. And the pharmacy guy knew my mom, and hey, here it is. Hope you get better, son. And they give you the medicine to make you better. And that was true. And so I think what's happened is the compounding world has figured out also to make more custom compounds that are more boutique type drugs that you can do with all this stuff that's out there today that those guys didn't have in 1955 and 65. Didn't exist. Now you've got this laundry list of things, of different things you could do and the different things that they can provide to the public. And those custom compounds are critical, in my opinion, to especially as a weapon. And I think it's one of the truest weapons for providers to use in their medical practice. And I'm on my soapbox here a little bit because this is real important to me, that providers are always allowed the ability to practice. That's a big word, practice medicine. And one of their biggest things they can use is drugs, mm-hmm. and the different things and chemicals to make us get better. And I'm going to lay up on this one because for instance, here is COVID with a drug called dexamethasone. It's a steroid for your chest and such. And doctors early on, when COVID hit out, struck out online, they have their I forget what it's called, but they have their online. They can basically see what other doctors are doing with drugs and trying to treat. And they found out early on that dexamethasone could treat this really quick and make a big difference. Well, dexamethasone's been around a long time, and it definitely did not go to clinical trial for COVID-19. It didn't exist, mm-hmm. But it works, and it's saved a ton of lives, and it's known, it's factual. And there we go. If doctors weren't, and a lot of them have used a compound of that because they want a higher dose than what's normally prescribed. So, but if doctors weren't allowed to use that drug off-label, if you will, because it wasn't meant for COVID, of course, and able to do the compounding of it, was how many people would we have tragically lost if it wasn't available? So this is compounding, and what compounding can do are those things like that right there, and especially when it comes to crisis. And so And not to mention in the hormone world, there's all kinds of other hormone therapies that other doctors through practice have thought of other ways to do things. I know I've talked to some guys in the organization that they have an idea by the second, of different things we can do, fantastic things with patients. But anyway, if you didn't have that art out there available, it would be really a tragedy. Very important.
No, I agree. So let's go back to your company, Qualgen. You have a second plant coming online soon. Tell us how big are you? How many employees do you have? What else do you manufacture besides BHRT?
Yeah, so we started out with just to give you a little history, we started out with a whopping 3 people making pellets. And I'll never forget it, with like 10 customers, 15, 20, you can grow up. And they got some great people out there that have always backed us, and God bless them for everything they've done for us. Had a lot of help along the way. Met a lot of great people, Jim. And then we grew that up to, we're now 40, we're 45, 47, somewhere in that range. We're almost 50 people, which that's going to be interesting because that changes things in the business side once you get to 50 employees.
Yes,
but
it does.
we rely very heavily on technology is one reason why we don't get that down. Most everything we do is very automated, which is very unusual in the compounding world, because usually things are very manual. Most everything we have is pretty much an automated system. Try to take the humans out of the element and not have their bioburden affect what we're making as much as possible. And we continue to thrive on that. We've got some new robotic systems that we've actually invented, a new system for complete robotics for pellet processing. And it's crazy awesome. I'm most excited about that. Probably within the next year. We just finished the final dibs on it working. Now we just got to go build the thing. So we did that. We've got our new facility, like you said, opening up here in Edmond, and then we have a new warehouse distribution center we opened because we just need a big warehouse to house all this stuff. So now we basically got a lab in one facility that does R&D and testing. Then we have a major manufacturing facility in the new facility, and then a warehouse that warehouses all the drugs. We're also going to be doing patient-specific GMP 503B drugs, which is extremely rare. Most of your patient-specific drugs are all just single compounds, and not using the GMP methods we use. These will be drugs available using GMP. We've also launched into testosterone cypionate, which is kind of the other side of the pellet. You've got it's an injectable, same thing, injection of testosterone. There's different people have different theories and beliefs and all that, but we're a drug company. We're here to serve everyone, so we make them both. And then there's that. And then we also we have a BLT cream, which is a benzocaine, lidocaine, tetracaine. That actually came to us. A lot of hospitals and clinics that are out of this stuff right now. We know the supply chain's crazy with different issues. And we got called to do that, as well as a LET cream. A lot of the hospitals are out of it. That's a lidocaine, epinephrine, and tetracaine cream. It's actually got to be sterile. We just started R&D on that. We got some creams, a progesterone cream, a lot of ointments, progesterone cream, testosterone, and a biased cream coming out. And then there's a bunch of other stuff. And on another front, which is a big thing to me, is I'm working with a new thing that's to try to help veterans. And that is, we've got a naltrexone pellet made for addiction and NAD to help with mind cells and restructuring the brain cells as they come back, and as well as ketamine for using in these clinics for depression. And of course, the number one, pellet therapy, is probably one of the top things to really help these veterans. And we're trying to put a system together nationally to really bind this together to really fight PTSD, and do a little TBI in there too. I think we can help with, and depression and addiction, because they tend to be something that goes together in the veteran world. And this is something really serious to me. And it's a mission and a calling a little bit, that I feel like this is a tide I got to get back. This is something we got to make happen, because and here we go with compounds. What the VA has done with drugs in the general population has not worked. I think that's agreeable. And I think we have the ability, and I think we have the system here to fight this and make a difference in these men and women's lives. And that gets me out of bed in the morning early. That, as we say down here in Oklahoma. So that's that's something I'm really after and I'm really excited about.
No, it sounds great. So when you're deciding to do all of this, from, manufacturing, a pellet at this point in time, are these your ideas, or is your team coming to you with these, or is it just the people that you're associating with, or potentially, I guess treating in an indirect way, that come to you with these ideas? Like, how do you decide to do this?
Well, other than divinity, I am not that smart. I'd like to tell you I am, but I'm not. I mean, I'm a pretty bright guy, but no, this is people around me. I'm so blessed, Jim, to have friends, my staff, people in your organization, people all around that have had these ideas. There's no doubt. And I like to put them to paper. Like I said early on, I like to build stuff, and I'm kind of that guy that can do that. And I love the excitement of being able to do something like that. But, I have my own ideas blend in with them, of course, but I'd have to say, when I started the pellet business, there's a guy named Dr. Gino Totero. I'll come back to him, and he's kind of a godfather of pellets way back in the day. And I was actually having a drink with him. It's how I got into this business. And I asked him what the biggest problem was. I said, what's your biggest problem with hormone therapy? And then the problem is there is no pellet nationally that is consistent. I train these people, and they go out in the hinterlands, and they go to these small mom and pop places to get pellets, and they're all made differently. And nothing wrong with them. There's no way I'm going to get a consistent result when they're all not the same. And so he was just mad, crazy about wanting to make hormone therapy perfect. I mean, he was just medieval about this, and he wanted, beyond anything else, the $1 million was great, but you could just see it in his eyes when he talked about this, that he wanted most of all that the whole world could be on hormone therapy. And the more we know about what it does, and if we have a consistent pellet and such, the better job we could do at treating people and collecting that data, of course, and doing things. So he said, hey, why don't you make a pellet? And I hit are you crazy? Because I've never done that. And I don't know, maybe it was a bet, a challenge. I don't know how that went down after that, but he talked me in. I don't know. He talked me into it. Somehow I think I lost all my money that night, my car keys and everything. And I ended up in the parking lot making pellets, because Gino was a great talker too. He's just a great guy. And the rest is history. And we've been making them since.
Well, I'll tell you, when we started using your pellets, which was a few years ago, I think it revolutionized our business, because before that, some of the other pellets from the other competitors were relatively inconsistent, not necessarily from an efficacy standpoint, but just from a placement standpoint. And, our patients tend to have a little bit more of an adverse event, post-placement. And with the Qualgen pellet, with your technology being different, our site inflammation, so to speak, has been reduced significantly. And I'm a perfect test case for that, I guess. And so when you started getting into it, then did you look at the competitors' designs and decide to do something a little bit differently with that, or did you just through just your own collaborations decide to do something that you felt would work better than what's out there?
And by the way, when we first did this, I only really knew about there was only one or two other big 503As doing a lot of volume, and I won't name the names. And in fact, one of them is a pretty good friend of ours, I consider these days. We're pretty close. We still compete, but they've got a quality product. Nothing wrong with that company. But that was about it. And so not really. Gino came to me and said, look, the other problem with a lot of the pellets at the time, they had povidone in them and this kind of thing, like Testapel's pellet and all this. And he goes, I don't want all that. I want a completely bio-identical pellet, so that just like this GMO kick everybody's on today or stuff, I don't want any of that in people's bodies. I want something that's completely natural. And what's funny is he wanted it to be with stearic acid as opposed to cholesterol, which we wanted to do cholesterol because it's a lot easier to work with and make it bind. And we'd actually made a cholesterol pellet. And I remember we came to him with it. He says, no, I want it with stearic acid. And I'm like, well, why? He goes, well, because nobody else does that. And I only want it to be less than 1%. And I'm like, how's that going to work? And so I'm not kidding. Our development of that pellet went from like 3 weeks to 6 months. We couldn't make it work. And to this day, there's the honest truth. And I can't tell you the secret sauce because like that Bush's Beans dog, he'd have to come after you and bite you. It's a secret. But honestly, we made a mistake in the lab, and that's how it worked. That's the honest truth. It's almost like the Graham Bell thing, you spilt the acid type thing. So
that's right.
That's literally what happened, and the grace of God, and praise to him that it's all his glory that we got that done. And there's no doubt about it in my mind, because I was almost to the point of giving up. I was like, we can't do this. It don't work. And he kept believing in us. It was funny. I'll keep trying. You can do it. You guys can do it. And I was at the wit's end, and I'll be dang it popped out, worked. And then the rest is history, as they say. So really, we just took a whole new course based on what he wanted to do. It had nothing to do with what anybody else had done or what they were doing or anything like that at all. It was just like, this is what I want, and that's it. And so, okay, so that's how we got there.
That's a great story. Getting back to the FDA one more time, not to keep bringing them up, but obviously you're in a highly regulated industry. How often are you audited? How often does the FDA come knocking on your door?
Well, that's an interesting question. It has a lot of resolve to it. And then what happens with those audits is another question. They're based on a risk assessment type thing. So they're to come out at least once a year or more, depending on risk. And we've kind of generally stayed in the 2-year mark, although I'll tell you, we've had our run-ins with them. I'll be honest about that. And it's been difficult, especially at first. And mainly just because we were a young 503B, didn't really understand the CFR as much as I thought we did. And that's just honest truth. 7 years later, a whole different degree of answer on that today. Plus, this is interesting. I think we had 1 or 2 people in our quality department back then. Now our quality department is almost 30% of our staff. Mm-hmm. So I'll tell you something. And the cost of that and everything else went through the roof. So, not to mention the level of knowledge, because we've got people in here that have got 30, 35 years big pharma quality experience in here too. So they're way over my head, and they're all scientists and have been doing this a long time. But that's basically the FDA side of that. I could say a lot there. I'm just going to try to be polite about it, and I'm just going to bow off from that standpoint and say that we work hard at that. Qualgen cares a ton about our quality, as we started this meeting, and we get criticized with some things I'm just kind of shaking my head on, because I know what's right and what's wrong and what somebody else says. And the problem with some of this guidance that they have, and that's what they call it, it's guidance, which guidance is interpretable. Mm-hmm. And that becomes the real significant thing that's tough with this for all of us, including the FDA, because they got an idea, we got one, we don't agree. Of course, they're the FDA, they win. But it's difficult. It's a very, very difficult business. And we've lost some 503Bs to that, some good ones. I can name a couple that I know the guys personally. They were great businessmen and good businesses. I really don't believe that the product was as bad as what we may have said, what happened. But be that as it may, it is where it is today.
Well, I think too, just from our experience, we weren't a big CRO by any stretch of the imagination, and we're working with smaller biotech and pharmaceutical. And in our industry, it's a multi-billion-dollar industry, and there's some big players, and they're almost, some of them are, bigger than a lot of the big pharmas, that are out there right now. And it seems like at the time, based on the bureaucracy and just based on human nature, what you tend to leave alone. And then what you don't know, even though they could be doing a great job, you tend to pay a lot of attention to. And in some cases, you respect that, because you don't want, a startup or a small company doing, things that are against, the good clinical practices in our case. And, but at some point in time, once you've proven yourself, then, hopefully you get left alone. So I understand where you're coming from on that. And, but it sounds like you've been able to navigate those waters, and you're moving your business forward, and you got a lot of great things happening at this point in time.
Yes, and then of course, as a businessman, any businessman, you're always looking for that one tree in the middle of the lake that you're about to hit, but you don't know where it is.
Yeah, they come out of nowhere sometimes too.
Yeah, when you talk about navigating waters, that's the first thing that comes to mind to me. So, no, we keep very diligent, and we're a fighter, and we believe in what we're doing, and I believe in this business huge. I think compounding is one of the greatest things in the United States because, that's a big thing. It's been here for a long time, and it's a practice as much as an art, and I said it again, it's a huge weapon for the providers, and it needs to stay around forever. It's so important to our medicine.
No, I agree. And I think also, you being a manufacturer in the U.S. as opposed to, a manufacturer in a different part of the world. And obviously politically, we've been talking about loss of manufacturing jobs for years and years and years. Do you feel like you're rewarded in a way by the government or appreciated because you're doing work in the States, or does that not really matter?
Well, that's a tough question. You put me on the spot, Jim. That
can be a political answer.
That wasn't
again,
very
right?
nice. You got to be very careful. Number one, let me say this, and I want to get this on record because anybody who's ever heard me speak before knows what I'm going to probably tell you right off the bat. Number one, this business is a business that I was called to do. It wasn't something I had to do, and I believe in it 100%. And I love it, by the way. I love drugs. I love the manufacturing. I love watching it help people, especially hormone therapy. I've seen this fix marriages. The sex lives of people come back together and they, move in together. And when you fix marriages, you fix families. And it's just phenomenal what it's done. I've seen it. I've personally watched it happen more than once, but now dozens of times. And number two, the company is a tithe back to God that we can hire and build as many employees in here as we can, because I believe in the sow of the seed type thing. If you teach somebody how to farm is a lot better than just giving them the food. So jobs create knowledge, create skills, create everything. And so everybody who works here has children, kids, aunts, uncles, and it goes beyond our 40-some employees. It goes, the company gives back to, feeding a community, to people that are going to school, to the kids that are getting to eat, everything. It's just, I almost weep at times. I go home and think about everything it's doing for those families, beyond anything else. That means a lot to me. So what the government thinks, I don't really care. I'm more into that I care about my employees and the people that work here, and we need to continue to grow so we can hire more people and grow more people, and especially here in Oklahoma too, help the biotech industry grow and make better medicines for people and lower the drug cost, if you will, because compounds can, and just continue to make that thrive. And so it's critical. And like I said, if the government's happy with me, then great. But I would have to say, on only note I would say about that is I haven't seen them helping. I haven't seen them in my building do anything for me lately.
Right. Well, I will say that, from our practice perspective too, your product has, helped a lot of lives, to your point, putting families back together. And, in addition to that, we got people that are, being told to power through, whatever's going on in their lives from their traditional doctors, and they come here and, Dr. Greg is able to balance, their hormones, balance their physiology. And then from there, they tend to bloom from a health perspective. And so I think we're on a mission, to your point, and I'm hoping that we both can continue to be extremely successful in what we do and how your product touches, the patients that we deliver services to. As we finish up, we always ask for 5 takeaways from our guest. So I'm going to throw it back to you and, have you partake some wisdom on our audience.
Wow, that's a tough one. Well, you kind of heard what I'm about, and I think you get that pretty fast. That God's first, family's right there, and if we're able to combine the two with business and what we're doing in here with that's how I believe we're doing. That's the ultimate, and that's what matters. That's the grip of it. And I think as far as success, like you said, I hope we are, but we're successful, Jim. We've already saved the lives of umpteen hundreds or thousands of people, regardless of what anybody else ever does. And that's a fact. And I've seen it too. I'm with you. I mean, Optimal Bio is one of our clients. We got hundreds across the nation, around the world. And I have seen this story so many times, like what you just said, it's not even funny. And so I go to bed every night knowing that what I'm doing it's getting that done for sure. And that is ultimate. And the more we can do things to produce that, and especially if it comes back to changing people's lives and saving families, I'm all in. I'm all in and always will be.
Yeah, I mean, obviously you're a man that's driven with purpose, and I think, you know, anybody that I know that has purpose ends up being successful. And but you've been an inspiration to talk to today. We loved your story, and God bless you and your family. And, you know, I'm glad we're working together. Thank you.
Thank you. Same to you, Jim. Thanks a ton, and God bless you guys. And tell Greg that he's the best TikTok dancer I've ever seen. And that guy's awesome. I love him. I love you guys, and appreciate everything you guys are doing.
Sounds great. I will let him know, and I'll tell you the story behind that someday.
All right.
All right. Take care, Shaun. Thanks.
This has been a production of Optimal Bio. Optimal Bio is CEO Tyler Brannon, podcast host and partner Jim Baker, medical director Greg Brannon, production assistance by Core Media, Beth Gravencourt, administrator, Kevin Duthu, executive producer. The podcast can be found on our website, optimalbio.com, on Apple Podcasts and Spotify. Our theme song is Sunwave by Paradiso, provided by Epidemic Sound.